certain insurances, if you want to even call them insurance, really Medicaid, for instance, is not insurance. It's a government entitlement for patients with low income. So in something like Medicaid, the reimbursement is less than it costs the doctor to take care of the patient, with including the overhead. Okay, so you've got these patients who are basically money losers for the doctors. And so doctors want to take care of patients. We went into this to take care of people. But financially speaking, you have to limit the numbers. So somebody, for instance, Medicaid, or somebody who has a very poor insurance, you may still want to take the insurance or the Medicaid because you want to help patients. You want to take care of people. That's what we're sworn to do. That's what we want to do. That's what we enjoy doing. That's what makes us happy, doctors, you know, in general. That's why we do this job. But you have to limit it financially, because if you did Medicaid patients all day long, you would not be able to have a financially sustainable practice. So that's the rationale. And so you have these only a few slots per day or per week. And so these patients who need medical care, Medicaid being the most obvious one, because the reimbursement is essentially the lowest, you've got them put off for weeks and months in some cases for problems that are not emergencies. So, you know, next thing you know, a patient's got a shoulder problem, and a Medicaid patient's like waiting for 2 months. So we've had patients come here and just, you know, scrape the money together, and they get seen, they get the good care, and they get it whenever they want it. There's no waiting. It's you know, gold standard orthopedic care, and they're happy as a lark. We've seen several patients that were waiting months and months, and patients are suffering, you know.